Hey everyone, and welcome back. Today we're diving deep into a topic that's really important for anyone living with diabetes or knows someone who is.
That's right.
We're talking about protecting your feet, specifically how to prevent those, well, kind of annoying and sometimes even dangerous diabetic foot ulcers.
Definitely dangerous.
Yeah,
Really important.
really important, yeah. So we're going deep today,
We are.
using the guidelines
Yeah.
from the International Working Group on the Diabetic Fit.
They are the experts. They're the IWGDF, and their guidelines have some really practical advice
They do?
that can make a big difference.
Absolutely. So we're going to break this down into 5 main areas, kind of like our attack plan.
Good plan.
So we're going to talk about figuring out if your feet are at risk in the first place,
Okay.
and then how to check them regularly.
Yeah. Right.
And what you need to know to take good care of your feet,
Yeah.
making sure you have the right footwear,
Important.
and then tackling those risk factors head on.
Yes. Now, here's a little heads up about how often you need to check your feet.
Okay.
You ready for this?
I'm ready.
It might surprise you.
Oh, okay.
It all depends on your risk level.
Okay. Interesting.
We're going to get to that.
We will. So first off, how do we know if our feet are at risk?
Well, the guidelines are super clear on this. Every single person
Okay.
with diabetes, every single person needs a foot exam at least once a year,
Okay.
even if they don't have any obvious problems.
So even if you think your feet are A,
Yes,
that yearly checkup is a must-do.
absolutely.
Why is that so important?
Well, those exams are looking for two main things.
Okay.
Loss of protective sensation, sometimes called LOPS, and peripheral artery disease, which we call PA.
Okay.
Those are the two biggies. Those are the two red flags when it
Ah.
comes to ulcers.
Right, so let's break that down a bit.
Okay.
LOPS is about the sensation in your feet, right?
Yeah, so you might not even feel a small cut or a blister forming.
Exactly.
That's the danger.
So like you wouldn't know you had a problem until it became something serious.
That's right. You might not realize it at all.
Right.
Because you can't feel it.
And then PAD, that one affects the blood flow to your feet.
It does.
That sounds scary too.
It is. PAD can slow down healing
Hmm?
and make infections more likely.
Oh, wow.
That's why those annual checks are non-negotiable.
Yeah.
You want to catch those things early.
Gotcha. Okay. So now we know who's at risk. What about regular inspections after that?
Great question.
Is it the same for everybody or does it vary?
It varies a lot.
Okay.
The IWGDF uses a risk stratification system,
Okay.
which is basically a fancy way of saying, they categorize people
Okay.
based on their likelihood of getting ulcers.
Makes sense.
They have 4 levels, 0 to 3.
Right.
0 is the lowest risk.
So if you're level 0, you're basically in the clear.
Yeah, pretty much.
Okay.
Level 0 means no LOPS, no PAD, very low risk.
Okay.
But as we go up those levels, things can get a bit more serious.
Okay, let's talk about those other levels then.
Okay.
What bumps someone up to a higher risk category? Like what are those red flags?
A few key factors. A history of foot ulcers
Okay.
or amputations.
Oh, wow.
That automatically puts you at a higher risk.
Right.
Same for end-stage renal disease.
Okay.
And then things like foot deformities, limited movement in your joints, and even calluses.
Wow, I never realized calluses could be a warning sign.
They can be. Calluses are often a sign
Oh.
of high pressure and friction on certain areas of your feet.
Okay.
And that can lead to ulcers if they're not managed.
So even things that we kind of brush off as minor can be really important clues.
Yes. That's why knowing your individual risk level is so important.
Right.
It determines how often you need those checkups.
Okay, that makes a lot of sense. So walk me through those checkup frequencies.
Okay.
How often should someone at each level be getting their feet checked?
So level 0, that very low risk group, they just need an exam once a year. Since the risk is so low, that's usually enough.
Once a year for the low risk folks. Got it.
Mhm.
What about level 1?
So level 1 is considered low risk. They have either LOPS or PE, but not both.
Okay.
The recommendation for them is a foot exam every 6 to 12 months.
Okay, so at least twice a year
Mm-hmm.
if you have one of those risk factors.
Mm-hmm.
What about level 2, the moderate risk category?
So level 2, you might have both LOPS and PE,
Okay.
or maybe one of those conditions plus a foot deformity.
Okay.
We're talking about checkups every 3 to 6 months, stepping it up a bit.
Makes sense. The more risk factors you have, the more frequently you need those checkups.
Mhm.
And then level 3, the highest risk.
Level 3 needs the most frequent attention. They've either had a previous ulcer or
Uh-huh.
amputation, or they have end-stage renal disease,
Oh.
along with LOPS or PA.
Okay.
They need to be getting their feet checked every 1 to 3 months.
Wow. So that could be almost monthly.
It could be.
That really highlights how important those checkups are for preventing ulcers from developing.
Absolutely. And it's not just about those regular checkups with your doctor. Educating yourself, your family, and even your healthcare providers
Oh, wow.
is super important too.
Yeah, I can see why. Knowledge is power, especially when it comes to something as preventable as this.
Right.
So what are the absolute must-knows for someone with diabetes? Someone who wants to protect their feet.
Okay, here's the big one. Never, and I mean never, walk barefoot.
Gotcha.
This applies whether you're inside or outside.
Okay.
Even those comfy slippers might not offer enough protection.
So even slippers aren't enough.
It might seem over the top.
Yeah.
But remember, we're minimizing risk here. Even a tiny scratch
Oh, okay.
or a pebble you step on, it can become a big problem if you have LOPS and don't even realize it.
I see. So no barefoot walking, ever.
Ever.
Got it. What else should we be doing?
Daily foot inspections are a must. And I'm not talking about a quick glance. You need to be checking the entire surface of your feet, top and bottom,
Yeah.
even between your toes. Don't forget to check inside your shoes before you put them on.
You're right. I never thought about checking my shoes.
Yeah.
What else goes on that daily foot care checklist?
Washing your feet daily with warm water
Okay.
and gentle soap. Make sure to dry them thoroughly too, especially between your toes.
Okay.
And if your skin gets dry, use a moisturizer.
Right. Basic hygiene, but so important.
Mm-hmm.
What about toenails? Any special instructions there?
Toenail care is crucial too.
Okay.
When you trim your toenails, always cut straight across.
Okay.
Avoid rounding the edges or cutting them too short because that can lead to ingrown toenails.
I am so guilty of rounding those edges.
Yeah, it's a common mistake.
Yeah.
But it can cause problems. And here's another big one.
Okay.
Avoid using harsh chemicals, medicated plasters,
Okay.
or any DIY techniques to remove calluses or corns.
So no more at-home pedicure experiment.
Exactly. Podiatrists have the tools and the expertise
Okay.
to remove calluses safely
Okay.
and address any underlying issues that might be causing them.
Great advice. So we've covered daily inspections, washing, moisturizing,
Right.
careful toenail trimming, and leaving callus removal to the pros. Is that everything when it comes to patient education?
Not quite. Those practical steps are super important,
Mm-hmm.
but structured education from your healthcare provider is equally crucial. They can go into more detail and answer any questions you might have.
So it's not just knowing what to do, but really understanding why behind it all.
Yeah, exactly. And this is where it gets really interesting.
Okay.
For those who are at moderate to high risk of ulcers,
Mm-hmm.
daily monitoring of their foot skin temperature can be a game changer.
Wait, what? Checking the temperature of your feet can help prevent ulcers?
It can. It's all about catching those early signs of inflammation.
Yeah.
If you notice a significant temperature difference between, say, similar areas on your 2 feet, that continues for 2 days in a row, that could signal inflammation brewing beneath the surface.
So you're basically catching a problem before it even becomes visible.
Exactly, like an early warning system.
Wow, that's fascinating.
If you do notice that temperature difference, the guidelines recommend reducing your activity
Okay.
and contacting your healthcare provider right away.
Right away. Mm-hmm. So we've covered identifying at-risk feet,
Mm-hmm.
regular checkups, and patient education. What's next?
Let's talk about footwear.
Okay.
You wouldn't believe how many foot problems
Oh, right.
can be avoided just by wearing the right shoes.
I feel like you're about to drop some serious shoe wisdom. I'm ready for it.
Okay, first things first.
Okay.
For anyone at moderate risk for ulcers, that's our level 2 folks.
Right.
Or those who have healed from a non-plantar foot ulcer, which puts them at level 3.
Okay.
Therapeutic footwear is highly recommended.
Okay, hold on. What exactly is therapeutic footwear?
Therapeutic footwear is specially designed to fit the shape of your feet and minimize pressure on the soles, which we call plantar pressure.
So it's not just about comfort,
Right.
but actually distributing pressure
Yes.
to reduce that risk of ulcers.
Exactly. And for those who have healed from a plantar foot ulcer,
Okay.
they need therapeutic footwear that has been proven to relieve that plantar pressure while walking.
Okay.
It's crucial for preventing a recurrence.
That makes a lot of sense. What about the rest of us who haven't had ulcers yet? Any shoe advice?
Of course, even if you haven't had an ulcer, poorly fitting shoes can cause all sorts of problems.
Oh, yeah.
Always prioritize shoes that fit well
Okay.
and provide good support. Avoid anything that's too tight or too loose.
This is where I confess to owning a pair of shoes that are way more stylish than comfortable.
Oh, yeah.
Lesson learned.
We've all been there. But remember, your feet are carrying you through life, so treat them well.
Yes.
And for those dealing with callus buildup,
Okay.
there's another tool we can add to the toolbox.
Ooh, tell me more. Calluses have been coming up a lot today.
They have.
Yeah.
That's because they're a common issue.
Okay.
And a potential warning sign for ulcers, orthotic interventions,
Okay.
like silicone toe protectors or custom-made orthotics,
Okay.
can be really helpful for managing those calluses.
So these orthotics are basically redistributing pressure and protecting those problem areas.
Exactly. They can make a big difference
Okay.
in preventing those calluses from developing into something more serious.
This is all so practical. I love it.
That's exactly what these guidelines aim for.
Yeah.
To give people with diabetes the tools and the knowledge to take control.
Okay, speaking of taking control, what about those risk factors that we talked about earlier?
Yeah.
What can we do to address those?
Prompts treatment of any pre-ulcerative signs. Calluses, ingrown toenails, or fungal infections
Calm down.
is absolutely essential.
So we're talking about staying on top of any little issue that pops up.
Absolutely. Addressing these issues early
Yeah.
can significantly reduce your risk of developing ulcers.
Okay.
And believe it or not, exercise can play a role here too.
Okay. Exercise for preventing foot ulcers.
It can.
Tell me more.
For people at low to moderate risk, foot and mobility exercises
Yeah.
can be really beneficial.
Okay.
These exercises help improve foot and ankle range of motion, which can reduce peak pressure on your feet
I see.
and may even improve neuropathy symptoms.
Oh, okay, so I'm seeing the connection now.
Yeah.
Better range of motion means less pressure,
Mm-hmm.
which leads to healthier feet overall.
It's all connected. And for those same low to moderate risk folks,
Okay.
even a moderate increase in walking can be a good thing.
Oh, okay.
Something as simple as an extra 1,000 steps a day can make a difference.
So we're not talking marathon training.
Yeah.
Just adding a bit more movement into your day.
That's right. Of course, always talk to your doctor before starting a new exercise routine.
Yeah, great point. So we've covered a lot of ground here.
We have.
Identifying at-risk feet,
Mm-hmm.
regular checkups, patient education,
Right.
proper footwear, and even the role of exercise.
Yeah.
Is there anything else we absolutely need to know?
There's one more important concept
Okay.
I want to touch on. Integrated foot care.
Ooh, that sounds intriguing. What does it head entail?
Integrated foot care is a holistic approach
Okay.
that brings together professional foot care, appropriate footwear, and structured patient education.
So it's like a three-pronged attack on those ulcers, combining all the best strategies.
Exactly. And this integrated approach is especially important for those at high risk of ulceration,
Okay.
our level 3 group.
Yeah, makes sense. They need all the support they can get.
Mm-hmm.
And how often are we talking about for these integrated foot care visits?
The guidelines recommend frequent follow-ups every 1 to 3 months to reassess and adjust the care plan as needed.
Wow, we have covered a lot of information today.
We have.
I'm feeling a lot more informed about preventing these ulcers.
Good.
What are the key takeaways for our listeners?
I think the biggest takeaway is that early detection
Mm-hmm.
and consistent care are absolutely crucial.
Okay.
If you have diabetes, get those yearly foot exams, even if you have 0 symptoms.
Okay.
And if your risk is higher, those checkups need to happen even more frequently.
Right. And don't forget those daily foot checks at home.
That's really
We talked about all those important steps. Inspecting your feet carefully, washing and drying them thoroughly,
Mm-hmm.
moisturizing dry skin, cutting your toenails correctly, and knowing when to call in the professionals for callus removal.
Yeah.
Don't underestimate the power of proper footwear
Right.
and those orthotic interventions we discussed. They could really make a difference.
Mm-hmm.
And even moving your body a bit more can be beneficial.
Absolutely.
It's all about being proactive
Mm-hmm.
when it comes to managing your foot health.
I couldn't agree more. And while these guidelines provide a fantastic roadmap
Yeah.
for prevention, there's still more research to be done.
Really. What are some of the areas where we need more information?
Well, we need more data on the most effective ways to screen for ulcer risk, especially in people who haven't had any problems yet.
So finding better ways to identify those who are most likely to develop ulcers in the future.
Exactly. We need more sensitive and specific screening tools
Okay.
that can help us catch those folks early.
Makes a lot of sense. Early detection is always key when it comes to preventing any complications. You also mentioned there's not a lot of research on interventions
Mm-hmm.
to prevent those first-time ulcers.
That's right. We have a lot of evidence on how to treat existing ulcers.
Yeah.
But when it comes to preventing them altogether,
Right.
there's still a lot to learn. We need more high-quality studies
Okay.
to figure out which interventions work best for different risk groups.
So a one-size-fits-all approach isn't the best way to go?
Exactly. What works for someone at low risk
Yeah.
might not be enough for someone at higher risk.
Okay.
We need more tailored approaches.
And then there's the cost-effectiveness piece.
Yes.
You mentioned that as an area that needs more research.
Yes. Healthcare resources are limited.
Right.
So it's crucial
Yeah.
to understand the cost-effectiveness of different interventions. We need to figure out which ones provide the most benefit
Okay.
for the lowest cost.
That's really important.
Yeah.
It's not just about what works, but about what's sustainable in the long run. What about adherence to these interventions?
Right.
How big of a factor is that?
Adherence is absolutely crucial.
Okay.
Even the most effective intervention won't work
Right.
if people aren't following the recommendations.
Yeah.
And unfortunately, adherence rates for diabetic foot care can be pretty low.
So it's not just about giving people the information,
Right.
but also about finding ways to help them actually make those changes.
Absolutely. We need to find ways to make those interventions more accessible, more convenient, and frankly, more appealing to people with diabetes.
Right.
We also need to address any barriers to adherence, like lack of knowledge, financial constraints, or lack of social support.
It sounds like a multifaceted approach is needed.
It does.
We need to consider the individual, the healthcare system, even the larger social context.
Absolutely.
You know, it's a reminder that health isn't just an individual responsibility. It's a shared responsibility
It is.
that requires a supportive environment.
I couldn't agree more. And I think that's a great segue into what I wanted to leave our listeners with today.
This idea of shared responsibility when it comes to health, I really like that.
Right.
So what's that final thought you wanted to leave our listeners with?
Well, we talked a lot about the importance of prevention.
Right.
But what happens when those preventative measures aren't enough?
Okay.
What if someone develops a diabetic foot ulcer?
That's a tough question,
It is.
but a reality for a lot of people.
It is. And it's important to remember that even if an ulcer does develop, there are still effective treatments available.
Okay.
Early detection and prompt treatment are key.
So even if you've done everything right, there's still a chance that things could go wrong.
Unfortunately, yes. But that's why it's so important to be vigilant.
Okay.
Know the warning signs
Right.
and get medical attention right away.
Okay, be proactive.
Yeah.
Makes sense. Speaking of being informed,
Yes.
there's one area we haven't touched on yet that I think is really interesting.
Oh, okay.
The role of technology
Right.
in diabetic foot care.
Yes. There are some really innovative developments happening right now.
Oh, okay. Like what?
For example, smart insoles
Oh, wow.
that can monitor pressure and temperature
Really?
of your feet in real time.
That's so cool. It's like having a little lab inside your shoe.
Yeah, so these insoles
Yeah.
have special sensors built into them
Uh-huh.
that collect data as you walk. And that data can be sent to your smartphone or directly to your doctor.
Okay.
It gives you and your healthcare team
Yeah.
valuable insights.
So you're basically getting continuous monitoring,
You are.
which could be a huge help in catching those early warning signs.
Exactly. And there are also apps
Oh, cool.
that can help you keep track of your daily foot care routine, remind you about appointments, and even provide educational resources.
Wow. Technology is really changing the game.
It is. It's a game changer for
Yeah.
sure. And as these technologies evolve, they'll play an even bigger role in the future.
Absolutely. You know, thinking back on what we've discussed today,
Mhm.
it seems like a lot of this comes down to awareness,
It does.
both for people with diabetes
Right.
and their healthcare providers.
I completely agree. It's about shifting our mindset from reacting to problems
Right.
to proactively preventing them.
So having those open conversations with your doctor, advocating for yourself, and staying up to date
Absolutely.
on those guidelines.
And for healthcare providers. It's about being thorough in those foot exams, providing good education, and really partnering with their patients.
So it really is a team effort,
Yeah.
both the patient and the healthcare provider.
Absolutely. And remember, even though there's more research to be done, the guidelines we've discussed today offer a fantastic framework for preventing these complications.
It's all about being informed and proactive.
I couldn't have said it better myself. Now, thinking about all this research that's still needed,
Yeah,
it does raise some interesting questions, doesn't it?
it does. You mentioned earlier that we need better ways to screen for ulcer risk, especially for those who haven't had any problems yet.
Yeah.
What are some of the challenges in developing those kinds of screening tools?
One of the biggest challenges is finding that balance between sensitivity and specificity.
Okay.
We want a screening tool
Yeah.
that can accurately identify those at risk
Yeah.
without flagging too many people who are actually fine.
Right. So it's about finding that sweet spot where we're catching the people who need extra attention
Yes,
without creating unnecessary worry for others.
exactly. And the other challenge is finding a screening tool that's easy to use,
Right.
affordable,
Yeah.
and accessible to everyone.
So it needs to be practical,
It does.
feasible in a real-world setting. What about research on interventions? You said we need more studies
We do.
to figure out what works best for different risk groups. What are some of the roadblocks there?
One of the biggest roadblocks is simply funding.
Ah, yes.
These studies are expensive and
Yeah.
time-consuming,
Mm-hmm.
and it can be difficult to secure the necessary funding.
That's a common problem
It is.
in medical research,
As
isn't
it
it?
is. And another challenge is recruitment.
Oh.
Finding enough participants
Yeah.
for these studies can be tricky.
Especially when we're looking at specific risk groups.
Yeah.
So even if you have the funding,
Right.
we need willing participants
We do.
to make these studies a reality.
And once we've conducted the studies,
Yeah.
there's the issue of translating those findings
Right.
into clinical practice.
That can be a slow process.
It can.
It often requires changes in policies and guidelines.
It does.
You know, it's a reminder that research is just one piece of the puzzle.
Mm-hmm.
We need to focus on that implementation,
Yeah.
making sure that these findings
Yeah.
reach the people who need them.
Exactly. And that brings us back
Yeah.
to that idea of shared responsibility.
Mm-hmm.
Researchers, healthcare providers, policymakers, and individuals
Right.
all have a role to play.
It's a group effort for sure. You've given us so much to think about today.
Good.
What are your final thoughts on preventing these diabetic foot ulcers? What do you want our listeners to take away from this deep dive?
I hope our listeners feel empowered to take control of their foot health
Okay.
and to advocate for themselves within the healthcare system.
Yeah.
I also hope they understand that prevention is the best medicine,
Right.
and even small changes in their daily routine can make a huge difference.
Those are great takeaways. I'm feeling a lot more informed and motivated
Good.
to take care of my own feet, and I don't even have diabetes.
That's wonderful to hear. And remember, even if you don't have diabetes, these guidelines can still be helpful.
That's a good reminder. Healthy feet are important for everyone.
They are.
So now, thinking about all the information we've covered, one question keeps popping up in my mind.
Right.
We've talked about how important those regular foot checks are, you know, and how the frequency depends on your individual risk level. But I'm curious, for someone with, like, a busy schedule, those frequent visits, especially for those higher risk categories, it might seem like a lot to manage. Are there ways to make this more doable, or are those in-person visits absolutely essential?
That's a great question. And a very valid concern. It's all about finding a balance that works for each person.
Right.
While those in-person checkups are really crucial,
Yeah.
especially for those at higher risk,
Okay.
there might be some flexibility depending on your specific situation and the resources that are available.
So it's not necessarily like a hard and fast rule that you have to see your doctor every month,
Right.
even if you're at that highest risk level.
Exactly. For some people, especially those who are really on top of their foot care and haven't had any recent issues,
Yeah.
a combination of those in-person visits
Okay.
and virtual check-ins might be appropriate.
So something like a video call with your doctor to kind of review your routine
Exactly.
or address any specific concerns.
Exactly. Technology can play a role here.
Yeah.
And with those smart insoles we talked about earlier,
Right.
your doctor may even be able to monitor your foot health data remotely.
That's amazing. So it seems like technology is really opening up these new possibilities for more personalized care.
It really is. And as these technologies continue to advance,
Yeah.
I think we'll see even more creative ways to deliver care and support people in managing their health.
That's really exciting. So to wrap things up,
Yeah.
what are your absolute top tips for preventing these ulcers?
Know your risk, check your feet, and wear the right shoes.
I love that. Know your risk, check your feet, and wear the right shoes. So easy to remember.
And it's powerful.
And powerful, yes.
And don't forget, It's never too late to start taking better care of your feet.
Yeah.
Whether you've been living with diabetes for years or you're newly diagnosed, these guidelines can really help you stay healthy and active.
Absolutely. Thank you so much for sharing all your expertise with us today.
You're very welcome. My pleasure.
This has been so insightful.
Good, I'm glad.
And remember, everyone, if you have any questions or concerns about your foot health, don't hesitate to reach out to your healthcare provider.
They are your partners in this journey.
That's right. And to all of you listening, we hope you've enjoyed this deep dive into diabetic foot care. Until next time, stay curious and take good care of those feet.